My name is Dorcas. I was born in Marondera, in Chota village, actually. And I spent my early years in this beautiful city. It's a very small city, very rural. Went to Marondera, schools in Marondera, and moved to the UK when I was 21. To Scotland, where I loved, and I worked as a hospital cleaner initially, and then moved to London, and then where I was trained as a nurse and now a global health consultant. But at the bottom of who I am and what I love and what I adore is this Africanness in me, and that's always remained anchored in who I am, what I believe, what I value. It's very much anchored in those values, and that was set in me in those early years. And back then, things were beginning to sort of fall apart in the healthcare system in Zimbabwe, and they set up this charity to support healthcare training in the system. So support your doctors and your nurses and midwives through training, on the assumption that if you train people, they're able to support the healthcare system and support others more. You do that by training in mental health, quality issues, family medicine, epilepsy, and one of the areas that we've really been successful in is in mental health. And one of my proudest moments have been those moments where we've trained nurses and midwives in Binga, rural areas, so far from anything. And under, of course, the supervision and guidance of Dr. Tinashe Goronga, a phenomenal Zimbabwean who's so interested in sort of family medicine. Beautiful moments teaching in Chitungiza Hospital. Love that. Pilo Hospital in Guchani, and many room, a lot of training in Harare. And it is exactly those roots and that tradition that has kept the charity going, even when we couldn't be there during particularly the pandemic period. British Zimbabwe Society grant then gave us a really good opportunity to do some meaningful workshops. So we've been doing some workshops in Bari. The last one was on men's health, because we agreed there's a lot of focus on young girls, rightfully so. They're so vulnerable, but actually if you really look, and this is linked to the work that I've done in London with young people involved in gangs, is that young men too are really being left behind. They miss that structure, that parenthood, that fatherhood. You know, the fears of becoming a dad can easily lead to suicide. The fears of not having a job, the sense of worthlessness can really dig deep, and we know that their suicides are quite high, particularly in young men. So we had this amazing workshop in Bari, which we just really kind of sort of opened up the space and had some meaningful discussions, but also really touched on issues of sexual violence. What does consent look like? I think Chido handles that so well with young men. How do you know when a girl doesn't want to? Even if she's gone on a date with you and she's come home with you, how do you know when she doesn't want to have sex with you? And how do you know when you're compromising yourself as a young man? So really, really interesting. I'm so proud of that stuff, because I think to me it speaks to what's possible even when the pandemic hits. It's possible for diaspora to continue to have impact. It says that we've done something on the ground in terms of supporting the leadership on the ground. It says a lot about what young people can do when you support them. Often we think as adults, we have it all, we can do it all. But these are young people in Bari who are everyday folk. 20s, maximum 25, who, when called upon, they'll come out and support people who are even more vulnerable than them, and I think that just warms my heart.
No, it is. I think this young generation